You're listening to the Mother-to-Baby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. Also, quick disclaimer. The opinions shared by our guests are their own and don't necessarily reflect the views of Otis Mother-to-Baby. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a Mother-to-Baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother-to-Baby Podcast. My name is Chris Stallman, and I'm a mom of four, a genetic counselor, and a teratogen information specialist. So what that means is that I talk to people, so patients, families, healthcare providers, and members of the general public about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication that you take or a supplement. It could be a chemical at your workplace. Lots of different things can be exposures. Today, we're going to be talking about a group of medications called glucagon-like peptide-1 agonists. For short, we're going to call that GLP-1 medications. And these medications have been used to treat conditions like type 2 diabetes and are sometimes used for weight loss. So brand names you might be a little bit more familiar with are ones like Trulicity, Ozempic, Mounjaro, Zepbound, just to name a few. We have a special guest here to talk with us about these medications, and we are very excited to welcome her onto the show. Dr. Christina Han is interim chair and executive medical director of Obstetrics and Gynecology and co-director of the Diabetes in Pregnancy program at UCLA. Her primary areas of clinical and research interest are maternal endocrine disorders, advanced prenatal diagnosis, and preconception optimization of maternal health. Dr. Han is also a member of the board of directors for the Society of Maternal-Fetal Medicine. Dr. Han, thank you so much for joining us on the podcast today.
Thank you so much for the invitation. I'm very excited to come talk to everyone about this recent advancement and how it impacts pregnant people.
Absolutely. And as you mentioned, this is something that's come up recently, but has absolutely been one of the things that there's been a lot of talk of, both in the medical space and in the public as well. So we're going to dive right in. One of the biggest questions we get is, can taking a GLP-1 medication make it more likely to get pregnant?
That is a wonderful question. We do know that a patient's body type can significantly affect their ability to become pregnant. So a lot of infertility work has been done around the realm of polycystic ovary disease, around extra fatty tissue, obesity. And this is exactly the target audience that these medications have been designed for. So if we think a little bit about just what's happening inside a woman's body that allows them to get pregnant, in order for everything to work correctly, the brain has to talk to the ovaries, the ovary has to work in conjunction with your uterus and the lining. And when there is extra fatty tissue in our body, that can impact how those pathways work. So when somebody goes onto one of these medications, it reverses a lot of that process. When they are able to drop their weight, sometimes the extra testosterone state in PCOS can reverse somewhat. And all of those effects, very similar to bariatric surgery and gastric bypass, certainly can make somebody's ovulation status, their ability to become pregnant, much more possible.
So if someone is taking a GLP-1 for managing diabetes in particular, if they become pregnant, should they keep taking it, or what is the current guidelines or recommendations that are out there?
So I think it's important to just think overall in the health of any pregnant person, whether they're on these medications or diabetes. I always encourage everyone, especially those with medical conditions, to seek out preconception counseling so that these conversations can be had ahead of an accidental birth situation. So especially when it comes to somebody with pre-existing diabetes, we know that diabetes in itself can impact how an embryo forms. And that in itself is a teratogenic or a potential source of congenital malformation. Now, if we add on this medication, this is, again, a fairly new class of medications. We are starting to gather incremental amounts of data on this. However, we don't know everything yet. So far, what we do know is that these medications in themselves, when used at the doses that are commonly used in individuals, doesn't seem to have a big signal for congenital anomalies. However, when they are used at higher doses, it is possible that there might be an increased risk of miscarriage, possibly signals for congenital anomalies that we just don't have enough data to be able to detect yet. And so for all those reasons, when it comes to a medication that can so significantly impact your metabolism and your overall ability to hold on to nutrition, this is one of those medications where we do recommend that you reach out to your OBGYN, your maternal-fetal medicine doctor, your endocrinologist, to make sure that you fully understand its impact and figure out a timeline for when you should ideally stop this medication before entering into a pregnancy.
And it should be mentioned again, and I really appreciate you mentioning that diabetes in and of itself can also increase risks to a pregnancy. So it's not that the diabetes wouldn't be managed, certainly. And I appreciate your point that, individuals are just that, everybody's different. And so if you are pregnant or thinking about getting pregnant and you're taking one of these medicines or thinking about taking them, especially for diabetes, talk with your healthcare providers, have that conversation, hopefully before pregnancy, so that way they can figure out the best way to manage your condition if you do have a pregnancy.
Exactly.
So would it be just the same for obesity and weight loss? And again, a little bit different, right? Because very often when someone is pregnant, they may not necessarily be recommended to lose weight. But if someone is taking this medication just for lose weight, they would also be in consultation with their provider about an alternate, or would that look completely different because something like diabetes is not involved?
That's an excellent question. So obesity in itself is not quite as much of a concern for a person heading into a pregnancy. And so this is one of those situations where if I have the opportunity to sit down with somebody, we'll draw out a timeline. Are we thinking of having you on this medication for a few months, for a year, for 2 years? And then based on that, we would figure out a way to apply appropriate contraception so that they are not getting pregnant during that initial time period where they're rapidly dropping weight. We have a lot of data from, again, the bariatric surgery and gastric bypass world that when somebody is in a rapid weight loss period, that can significantly impact the health of the pregnancy. But we want to make sure that they've hit a plateau, that they have reached their goals before we head into this. Again, it's all just about figuring out your timeline, figuring out what works for you and your family and your planning.
Absolutely. We certainly get questions about GLP-1 medications and pregnancy, and still get them about breastfeeding as well, because sometimes folks are not taking GLP-1s before the pregnancy occurs, and it may be something either that they or their healthcare provider are considering after the pregnancy has been delivered. So if a woman is limiting her food intake to lose weight during breastfeeding, is the baby getting all the nutrients they need from the milk, or would there need to be other supplementation or other concerns or issues to think about?
So again, it's an area where we don't have a large amount of data yet, but if we think through what's happening inside a woman's body during breastfeeding, there is a significant caloric requirement that's necessary to maintain that breast milk. And I think all of us who have been moms or have breastfed in the past can know that depending on how much we hydrate, depending on what we eat, the quality and the quantity of our breast milk really drastically changes on a day-to-day basis. And so we can imagine that if somebody is rapidly losing weight during that period and they are eating significantly restricted amounts, that is going to impact your ability to produce the amount of breast milk necessary to maintain the growth that's necessary for your needs. And so this is one of those situations where we don't encourage people to be actively trying to lose weight while you're on the breastfeeding journey. And it's about your life planning. So at whatever point you decide, this is the end of my journey, I'm ready to focus more on myself at this point, that would be an appropriate time to start to think about coming back on the medications if that's what you and your physicians decide.
Excellent. Dr. Han, thank you so much for being on the episode today. But before you go, is there a final thought you would like to leave the audience with?
I think there are so many benefits to this class of medication that really has opened up a really wide door to improving the health of our entire society as a whole. So I think a lot of it just requires advanced planning. And this might be right for you now. It might be right for you after your breastfeeding journey. Certainly do not close the door on this just because you are thinking about building your family, but just figuring out how to appropriately time it.
Thank you. And as a reminder, we do have resources about some of the GLP-1 medications, type 2 diabetes, and obesity during pregnancy and breastfeeding on our website, MotherToBaby.org. Again, Dr. Han, thank you so much, and we hope to have you back on a future show.
Thank you so much. It's been a pleasure talking to everyone.
And that's going to do it for this episode of the Mother to Baby podcast.
Be sure to hit that subscribe button so that way you never miss a new episode. And you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. And if you want to be on the podcast or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contact@mothertobaby.org. And Mother to Baby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847. By text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast. Or find out how you can participate in our pregnancy studies. If you would like to support the Mother to Baby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Visit mothertobaby.org/donate today. Until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.